Morning. Today we are going also to deal with the tissue level of organization. I would like to remind you that last time we were dealing with the epithelial tissue. There are 4 types of basic tissues in the body: the epithelial tissue, the connective tissue, muscular, and nervous tissue. Last time we dealt with the epithelial tissue, and so today we are going to deal with the connective tissue. And in fact, the connective tissue is the most abundant type of connective tissue that is present in the body. It is almost present everywhere in the body, and the function includes binding together, as the name indicates, connective tissue. So it connects and binds, and also it supports other tissues and strengthens other tissues. For example, we have seen like the basement membrane with the reticular lamina. It supports the epithelial tissue, for example. And also it protects and insulates the internal organs. So you will find that many of the internal organs in the body are surrounded by connective tissue, like an envelope of connective tissue separating it from other structures. Some organs are protected by connective tissue, like fatty tissue, for example, which surrounds the heart and surrounds the kidney. So it protects and insulates internal organs. Or it is in the form of blood. Blood is a kind of fluid connective tissue, and it transports nutrients and waste products. Or it is a source of immune response, like in the lymph. And finally, the adipose tissue, which is a kind of connective tissue, it stores the energy. So this is these are the main functions of the connective tissue, reminding you that it is the most abundant tissue that we have in the body. It is present everywhere. And the characteristics of this connective tissue is that the cells, they rarely touch each other. So because of the presence of a matrix, extracellular matrix, I would like to remind you, like in the connective tissue, in the epithelial tissue, you will find that the cells are tightly packed, and there is little, sometimes no, interstitial tissue in between the cells. And this is in contrast with the connective tissue, where the cells of the connective tissue are widely separated, and they rarely are connected or touch each other because of the presence of large amounts of extracellular matrix. So this matrix, it consists of fibers and ground substance, and both of them are secreted by the cells of the connective tissue. And it determines the consistency of the tissue. For example, like it's pliable in cartilage, for example. It is hard in bone. It is fluid in the blood. So all this is determined by the extracellular material, which consists of fibers and ground substance. The connective tissue doesn't occur on free surfaces, like in the epithelial tissue is present on free surfaces. We have seen like the epithelium forms the surface of the skin, or it forms the lining of the gastrointestinal or the urinary tracts. But the connective tissue doesn't reach the surfaces. The connective tissue has a good blood supply and a good nerve supply, except for the cartilage. So it has good blood supply, and this is in contrast to what we have seen in the epithelial tissue. Remember, the epithelial tissue has a good nerve supply, but it doesn't have a blood supply. The blood is present in the underlying connective tissue, and the nutrients, they diffuse through the connective tissue until they reach the epithelial tissue. But in case of connective tissue, there is a good blood supply, except for cartilage and some of the tendons, and it has also good nerve supply, except in the cartilage. Cartilage and bone are kind of connective tissue, supporting connective tissue. So we are going to deal with cartilage and bone later on when we talk about the musculoskeletal system. Just to remind you that cartilage and bone is a kind of supporting connective tissue. So that's why we are including them with the rest of the connective tissue. Again, I would like to remind you that the connective tissue is formed of cells and extracellular matrix. The cells there are different types of cells here. So you can see that there are blast type of cells. Yes?
What do you mean by a free surface?
So, like this is a free surface, like the skin covering or the lining of the gastrointestinal tract. It's a free. So the epithelium always covers or lines, and deep to the epithelium is the connective tissue. But the connective tissue itself, it doesn't reach free surfaces. Okay? Yeah.
So if one of the functions is to protect an organ, how does it protect it if it's not on the surface?
How does it protect? Yeah. Because on the surface, like many of the organs, let's take an example as the lung, which is on the surface of the lung, there is the pleura. The pleura is formed of connective tissue, but again, it is covered and lined by simple squamous epithelium that secretes a material. So it's always there is a thin layer of epithelium. It makes a covering, but this covering is not only made of connective tissue, it's made of connective and epithelial tissue. Same thing is for the pericardium, same thing is for the peritoneum in the abdomen. Okay? Now, the types of the cells, now we are talking about the cells of connective tissue. So we have blast type of cells, means the cells that have the ability to divide. They retain their ability to divide, multiply, and produce the extracellular matrix. And these are like fibroblasts, or chondroblasts. Fibroblasts are the most numerous. Chondroblasts are present in cartilage. Osteoblasts are present in bone. So these are the blast type of cells. The other type of cells are called the cyte type of cells, like fibrocyte, osteocyte, chondrocyte. Again, chondrocyte is present in the cartilage, osteocyte is present in the bone, and they have very limited ability to divide or to produce the extracellular matrix. They are more mature cells. The other cells of the connective tissue are macrophages, and these are derived from monocyte cells which are present in the blood. And as their name indicates, macro means large cells, and phages means that they perform phagocytosis. So these are the phagocytic cells that they eat or engulf the bacteria, and also they remove the debris from the tissue. So we have, they are located in the tissues, not in the blood. In the blood there are monocytes, and then these monocytes migrate to the tissues, to the connective tissue. They form macrophages, and these macrophages will engulf the bacteria and the debris. Then we have plasma cells, and these are again derived from other types of cells which are called B lymphocytes, and they are responsible for the production of antibodies that fight against foreign substances. The other type of cells are mast cells, and these are especially present in allergic reactions because they produce histamine, which causes dilatation of the small blood vessels. And then we have adipocytes. The adipocytes are the fat cells which store the fat. I'm going to talk more about adipocytes in a moment. And then the cells, the white blood cells like neutrophils or eosinophils, they are present in the blood. Blood is a kind of fluid connective tissue. Neutrophils, they move from the blood and they go to the tissues, especially when there is inflammation, like an infection, like bacterial infection. So there will be a lot of neutrophils migrating from the blood to the tissue. If it is a parasitic infection, we will have more of eosinophils moving. And both of them are types of white blood cells that are present in the blood. So these are the types of cells. The most abundant are the blast type of cells, that they can multiply and they can produce the extracellular matrix, the fibers of that matrix and the extracellular material. The matrix, again, consists of ground substance and fibers. So the connective tissue consists of cells. We have seen the different types of cells, and consists of matrix, which is formed of fibers and ground substance. The ground substance, it supports both the cells and the fibers. It determines the consistency. As I mentioned, it might be fluid or gel or solid, and so it determines the consistency of the tissue itself. Like, for example, in the cartilage it is pliable, in the bone it is hard, in the blood it is fluid, it is like gel-like, for example, in the umbilical cord, in the embryo, and so on. It contains large molecules. There are very large molecules. Protein molecules and carbohydrates together are present there, and they bind the cells and the collagen fibers. I'm not going to deal with the chemical constituents here. Probably you will find more details in your textbook, but this is not required from you, the chemical constituents. Now I will deal with the fibers. So we mentioned that the extracellular matrix has the ground substance and the fibers, and we have three types of fibers. The most abundant types of fibers are the collagen fibers, which are formed, yes?
So we don't need to know anything about the GAGs?
No.
Okay.
So the fibers here are three types of fibers: the collagen fibers, elastic fibers, and reticular fibers. Collagen fibers are made from a protein called collagen, and they are large fibers, they are tough fibers, and they are resistant to pull. They are resistant, but they are pliable. They are not like hard like in the bone. They are not as hard as the bone. They are pliable, but they resist pulling, unlike the elastin fibers. Elastin fibers, like they are present in, for example, in the lungs and blood vessels, and they are smaller than the collagen fibers, branched, and they are, as the name indicates, they are elastic. So they can stretch, and then they return back to their original length, what we call elastic recoil. And this happens, for example, during respiration, the lung inflates. Inspiration is an active process, and the lungs inflate, but during expiration, it's just the elastic recoil of the lung. The elastic tissue will recoil, will return back to its original length, and so it will push back the air which has been inspired into the lung. It will push it out. Same thing like happen in large blood vessels, the arteries, for example, during contraction of the heart. The blood is pushed through the blood vessels enlarge, dilate, and then they will recoil back to their original diameter. So the collagen fibers, they resist this pull, but the elastic fibers are elastic. They can stretch and then return back to their original length. The reticular fibers are very small, thin, tiny fibers. They are made of collagen, but they are very tiny, thin fibers, and they are branched as well. And the main function of these fibers is that they make a framework of some of the organs, like the spleen or the lymph node. Remember that some of these reticular fibers, we have seen them here in the reticular lamina of the basement membrane. We mentioned that the reticular lamina is produced by the cells of the connective tissue. So this is another place where we find these reticular fibers, and in general they form the framework of organs, soft organs, usually soft organs like lymph node and the spleen. So these are the three main types of fibers that are present in the connective tissue: the collagen, the elastin, and the reticular fibers. The connective tissue is classified as follows. It is either, first of all, it's either embryonic or mature connective tissue. And so the embryonic connective tissue is either in the form of mesenchyme or mucoid or mucous connective tissue. I will deal with the embryonic connective tissue now. This is the mesenchyme. embryonic, could be mesenchyme or mucoid. This is the mesenchyme. The mesenchyme is actually, it is the origin of all the connective tissue, and it is present in the embryo during the embryonic period. That's to say, it is present in the embryo from the time of fertilization until 8th week of gestation. So for the first 8 weeks of life, the embryo contains mesenchymal connective tissue, which is the source of all the types of connective tissue. It is semi-fluid, and as you can see, the cells are widely separate from each other. They are irregularly shaped cells. After the 8th week, from 9th week onwards, we will have the second type of embryonic connective tissue, and this is called the mucus or mucoid connective tissue, like the mucoid connective tissue that is present, for example, in the umbilical cord. It's like jelly-like, and it supports the remaining part, or it supports the organs of the body of the embryo. So we have two types of connective tissue. The first one appears in the first 8 weeks of gestation, and it's called the mesenchyme. And the second one is the mucoid or the mucus connective tissue that is present from 9 weeks onwards, and it is jelly-like. Doesn't mean that the entire connective tissue of the embryo at that time is only mucoid or mucus, because at that time the mesenchyme is going to develop into the remaining types of connective tissue, and these are going to form organs, and this is the period of what we call organogenesis, development of the organs. Then we are more concerned about mature connective tissue. And the mature connective tissue, there are 3 types of mature connective tissue. Connective tissue proper, which is the main type of connective tissue we are concerned about today. And then we have supporting connective tissue, as I mentioned before, the bone and cartilage, which we are going to deal with when we study the musculoskeletal system. And then there's the liquid connective tissue or the fluid connective tissue, which is present in the blood and lymph, and we are going to study that later on in another block. So today we are mainly concerned with the connective tissue proper, and this is further subdivided into loose or dense connective tissue. Loose or dense connective tissue. So the connective tissue is either embryonic or mature. The mature is either the proper type of connective tissue or the other types. The proper type of connective tissue is either loose or dense connective tissue. Now I will deal with the loose connective tissue, which is again further subdivided into areolar connective tissue. This is the first type of loose areolar connective tissue. And this is almost present everywhere in the body. It is like the packing material. Whenever there is a space, it is packed by areolar connective tissue. Multiple types of fibers are present in it, and these are randomly arranged in different directions. They are not arranged in bundles like we will see later on in another type of connective tissue. They are in different directions, and it's not a single type of fiber. Remember that there are 3 types of fibers: collagen, elastin, and reticular fibers. So these 3 fibers are all present in this tissue in different proportions, and they are randomly arranged. And the ground substance is semi-fluid in nature. As I said, it's present in many places in the body and provides elasticity and support. We will see an obvious example of areolar connective tissue in the dermis of the skin, in the papillary layer of the dermis of the skin, and in the subcutaneous tissue. That will be during next week's lecture on the skin, the integumentary system, and I will remind you again about areolar connective tissue. The second type of loose connective tissue is the adipose tissue. And here we have one type of cells only, which is the adipocytes. So these adipocytes, as you can see them here, most of the cell cytoplasm contains fat droplets. And there is a rim of cytoplasm around the fat droplet, and the nucleus is present on the side. two types of this adipose tissue. We have white adipose tissue and brown adipose tissue. The white adipose tissue is present in the adults. Most of the adipose tissue in the adult is white adipose tissue. There are only very few locations in the adult that contain brown connective tissue. The brown connective tissue is present in the infant and in the fetus, and it's called brown connective tissue because it has a lot of blood supply and there are many mitochondria in the cell. So these mitochondria actually, they can burn the fat and they can produce heat, and so they are the source of heat. This heat can be disseminated in the body through the blood because there's a lot of blood vessels in this tissue. Mitochondria contain some iron pigment inside them, so that's why it's called brown adipose tissue. It is not common in the adult. The adult connective tissue is mainly white connective tissue. The function of this white connective tissue is that it reduces heat loss. So that's why it's present in large amounts in the subcutaneous tissue, just under the skin, which act as an insulator for the body. It serves as an energy reserve because this fat, that's why in case of starvation, for example, the amount of adipose tissue reduces in the body, and it increases in obese people. And it also supports and protects organs. For example, like the kidney is surrounded by a large amount of fatty tissue, which supports the kidney in its position. There's also a large amount of fatty tissue that surrounds the heart, the adipose tissue. It's a source of stem cells. Nowadays, they are using the fatty tissue as a source of stem cells. Before, they used the stem cells from bone marrow, but probably it is difficult to reach the cells that are present in the bone marrow. So the adipose tissue is readily present under the skin, and now they are working on these adipocytes in order to use them as stem cells in, for example, in repair and regeneration. A stem cell means that we call it a stem cell, like a multipotent cell, like a cell that can differentiate and it can multiply and differentiate to many other tissues. So that's why it's called stem cell. It can produce like muscle, it can produce nerve, it can produce epithelial tissue. So it is a multipotent cell that can produce other tissues, and it's called stem cells. So these stem cells, now there's a lot of work that the adipose tissue can work as stem cells in order to repair other organs. I would like to remind you that we mentioned previously, like for example, epithelial tissue can multiply and replace itself. But there are other tissues like the nervous tissue, or for example, the muscle tissue, myocardium, for example, the heart muscle. If it dies, then it will be just replaced by fibrous tissue. It doesn't have the ability to multiply and replace the dying tissue. So that's why now these new procedures are, or research is undergoing in order to find ways in order to regenerate these cells which originally cannot regenerate. And adipocytes is an important source of these stem cells. This is just to show you how the shape of the adipocytes, because they contain a very large fat droplet in the cytoplasm, and the cytoplasm becomes a very thin rim. So they have the, when you look at them in the histological section, it is described as having the chicken wire appearance. Here again, you can see that there's a lot of fatty tissue under the skin, subcutaneous tissue under the skin, and this is the subcutaneous tissue that is taken out in procedures now which are called liposuction, which is one of the most popular type of cosmetic surgery. They remove this fatty tissue by negative pressure through a cannula. Or if, for example, after pregnancy, the skin of the abdomen, especially the lower part of the abdomen, will become saggy, and they remove this extra part of the skin as well as the fatty tissue, and this is what is called tummy tuck. So again, this is to show you that there is a lot of fatty tissue under the skin, and this fatty tissue, extra fatty tissue, means that it needs more blood vessels. So this will put more burden on the heart. That's why hypertension, increased blood pressure is more likely in an obese patient, because the heart has to push the blood into new blood vessels that are required for this extra fatty tissue. Here, this is a case of starvation, and you can, as I mentioned, that the fatty tissue, it protects many organs. It acts like a cushion for example, the eyeball in the orbit, which is the place where the eye is located in the skull. Behind the eyeball, there is a pad of fat, and in cases of starvation, it's not only the fat under the skin that will disappear, but the fat behind the eye. So the muscles that move the eyeball will pull the eye post behind, and this is what we call sunken eyes. The other type of loose connective tissue is the reticular connective tissue. And here we have reticular fibers. These reticular fibers, or this reticular connective tissue, is mainly present in places where it forms a framework for soft organs like the spleen or the lymph nodes. And like for example, in the spleen, it not only acts as a framework for the organ, but it also, this mesh, this network of tiny fibers works like a filter. So it filters the worn out red blood cells, and these red blood cells will be attacked by macrophages. Same thing is true for the lymph node. It acts like a sieve, like a filter for the bacteria, and then the bacteria will be attacked by macrophages or by the antibodies from the plasma cells. So this is another type of loose connective tissue. So that we have, again, the connective tissue proper is either loose or dense. The loose connective tissue is either areolar, or it is adipose, or it is reticular connective tissue. So far about loose connective tissue, which is one type of connective tissue proper. The second type of connective tissue proper is dense connective tissue. As the name indicates, it's dense. It's not loose like the loose connective tissue, but we have here, again, subtypes. So we have dense regular connective tissue. In the dense regular connective tissue, we have mainly collagen fibers. And these are tightly packed, so it is dense. Regular means that the fibers are in one direction. So it's not only tightly packed, but the fibers, all the fibers, they form bundles. All of them are in one direction. So we have collagen fibers, one type of fibers. They are so close to each other, so it is dense and regular in one direction. Unlike, for example, in the areolar connective tissue, where the fibers are in multiple directions. Examples here of the dense regular connective tissue is in the tendons and ligaments. A tendon is the strong connective tissue that connects the muscle to the bone, and the ligaments usually connect bones to bones or other structures to each other, but usually it is between bones, the ligaments. It's clear from the structure of the dense regular connective tissue that it is a strong connective tissue. It provides strong attachment between the structures, like the tendons or the ligaments. You can see them here. All these pink fibers, these are collagen fibers. And in between them, you can see nuclei, flattened oval nuclei. These are the nuclei of spindle-shaped cells, which are the fibroblasts. Remember, fibroblasts are one of the type of blast cells of the connective tissue. So these are the cells that produce the collagen fibers. The cells of the connective tissue, they produce the fibers and the extracellular matrix. So here you can see collagen fibers, all of them in the same direction, and they are tightly packed to each other. And the fibroblasts which produce them, they are just sandwiched in between. The other type of dense connective tissue is the dense irregular connective tissue. So dense regular, like tendons and ligaments, and dense irregular connective tissue. And again, it is dense because it is tightly packed with fibers, like collagen fibers, but these are irregularly arranged. They are not in bundles, like what we have seen before. So they are in different directions, but they are dense. There's little amount of extracellular matrix. These are present in sheets, for example, like in the fascia, in the pleura, in the peritoneum. And again, as I have just mentioned, these sheets are covered by epithelial cells, by a single layer of epithelial cells. So they do not reach the surface, although they form sheets, but they don't reach the surface. So here you can see many of these examples here. For example, the capsule of a joint, not the ligament, the capsule. See, this is a knee joint covered by a capsule that envelopes the joint. And so the capsule is dense irregular connective tissue. Inside the joint, you can see that there are ligaments inside the joint, like the anterior and posterior cruciate ligaments. And these ligaments are dense regular connective tissue. So again, they are both of them are connective tissue, but different types of connective tissue. Dense regular connective tissue in the ligament, and dense irregular connective tissue in the capsule of the joint. Here there is the fascia surrounding the muscle. This is a muscle on the temporal side of the head. It's called temporalis muscle. If you clench your teeth now and you put your finger above the ear, you will feel the muscle contracting. And this muscle is enveloped by fascia. The fascia is dense, irregular connective tissue. So as the pericardium, it is that the layer that envelopes the heart is dense, irregular connective tissue. You can see here, for example, it is glistening because there is a single layer of epithelium covering it, and this epithelium produces serous fluid that lubricates, because the heart is always pulsating, so it needs some lubrication around it. And again, I would like to show you here that the heart is surrounded by adipose tissue. This is for like storage of energy and for protection. So this is another type of connective tissue, which is the adipose tissue, a kind of loose connective tissue, the adipose tissue. The other type of dense connective tissue is the elastic connective tissue. And this is, as the name indicates, it contains multiple laminae, multiple layers of elastic fibers. Remember, these elastic fibers that can stretch and recoil back. So you can see here that there are multiple laminae of these elastic fibers. These, as you can see that they are like undulating, they are tortuous because they can stretch and elongate. Multiple layers are present here. They are present in large blood vessels, for example, in the aorta here. This is a section from the aorta, large blood vessel. It's called elastic artery. So they stretch and recoil back. Same thing that what happens in the tissues of the lung. The main function is that they allow stretching. So dense connective tissue, elastic type of dense connective tissue. So these are the three main types of dense connective tissue. We have the dense regular connective tissue, like in the tendons and ligaments. We have the dense irregular connective tissue, like in the fascia, in the capsules of the joints, in the deeper part of the dermis, as we will see next time when we talk about the skin. You will find that the dermis consists of two sublayers. One of them is loose areolar tissue, and the other one is dense irregular connective tissue. And the third type is the elastic connective tissue, which is an obvious example that is seen here is in the wall of the great vessels like the aorta. It's also present in the trachea and the lung tissue as well. Any questions? Yes?
So we're not going over the nervous and muscular connective
Muscle?
the other cord
Oh, the other type of tissue we said epithelial connective tissue, then we have the muscle and the nerve.
Are we going over that?
Yes, well, but not next time. It will be, we are studying the musculoskeletal system. So we are going to, before we study the muscles, the anatomy of muscles, we're going to study its structure.